Okay, thank you. So, good afternoon, everyone. My name is Kay Spergel. I am the Executive Director of the Mental Health and Recovery Board for Licking and Knox counties. And it is my honor to introduce the Licking Knox Trauma Informed Care Leadership Committee, who would like to welcome everyone to this first session of our 6-part Trauma Informed Care Lunch and Learn series. We will get started in a few minutes as we only have half an hour for the presentation, followed by an optional 15 minutes of questions and answers with the presenter. We would ask that you would please complete the evaluation at the end of the session to let us know how we are doing, and if there is additional information or training that you would like us to sponsor in the future. While we are unable to offer CEUs due to the short length of each session, we will offer a certificate of attendance for those who are interested. Please include your name on today's evaluation if you are interested in that. Our sessions are being recorded for those who could not join us today. We will also offer resource information, handouts, PowerPoints to attendees. We are working these details out, so more information on this at a later date. We certainly hope that you enjoy and benefit from today's session. And again, I'd like to thank the full committee from both Knox and Licking counties that made this possible and all their planning. But I especially want to thank Sylvia Friels for all her support and all the hard work that she's put into this effort and putting this series together. Now, it's my great pleasure to welcome our presenter, Tamara Fry, who is the Executive Director of the Woodlands in Newark, Ohio. And Tamara, I'm going to let you introduce yourself and let you take it from here. How's that? Thank you, everyone.
That sounds good. Thank you, Kay. Thank you for that warm welcome. As she said, my name is Tamara Fry. I'm the Executive Director of the Woodlands. We are a local mental health therapy treatment facility. We provide outpatient mental health therapy, as well as one of our well-known programs is the Center for New Beginnings, which is Licking County's domestic violence shelter. So I am going to screen share in just a moment. So we can talk about what trauma is. All right, can everyone see the screen? Everything's good? Okay, thank you. So to kick off this series, we want to make sure that everybody understands what trauma is. Everyone comes from different backgrounds. Everybody has different life experiences. So some of you, this may be review for. For some of you, this may be your first dive into what is trauma. So we welcome all experience here. And I'm going to give you the basics, and the rest of the series is going to get into some finer detail. So what is trauma? Trauma results from an event, a series of events, or a set of circumstances that is experienced by an individual as physically or emotionally harmful or life-threatening, and it has lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Something important to think about when we think about trauma is that trauma is it's the experience, and it is the reaction that we are having to an event. You and I may go through an event and have completely different experiences. So while trauma, we think of it as the event, I want you to think about trauma as the reaction and the experience that you're having due to an event. There are multiple types of trauma. There are 4 broad categories here that we're going to discuss. And there are many, many examples of trauma that all tend to fall within these categories. Acute trauma is a single incident, time-limited event. Something that you can think of that would be an acute trauma would be like a car accident. Something that is one time, it's time-limited. Generally, hopefully, that's not something that you are chronically experiencing or that you're experiencing over and over again. Chronic trauma is a series of events, repeated and prolonged. Something that would categorize as chronic trauma would be something like domestic violence. Typically, domestic violence happens in a pattern, and it is a prolonged over time with repeated incidents kind of event. Complex trauma is kind of chronic trauma plus more. Complex trauma is multiple events that are overlapping and in succession. It is as much the exposure to the trauma as it is the repeated, the impact over and over again, and the beliefs and the values that people are developing out of that repeated experience. So a complex trauma can be something like, we'll use the first example. It could be like a domestic violence situation that somebody may be in, but perhaps this person is also living in poverty. They don't have the financial means to get out. They're experiencing other losses or griefs in their life. They have childhood trauma as well that is also compounding with this trauma happening currently. So complex trauma is accumulation of past and present trauma together. Secondary or vicarious trauma. This is trauma that is sustained when somebody is witnessing the details of another person's trauma. So perhaps they're not being directly exposed, but they are being vicariously exposed to the details of that trauma in a repeated manner. An example that we can think of for secondary or vicarious trauma could be something like someone who is a crisis line worker. So perhaps there's somebody that works for 211. Maybe they work for a rape crisis line or a suicide line. Hearing repeated details as a part of their job can wear that individual down and create a kind of vicarious or a secondary trauma. We have a lot of examples of trauma here, and I know that this list could probably go on for many, many slides, but we're going to keep it to this. These are not organized in any particular order, but we can see some themes here. So the first several: house or domestic fire, car accident, catastrophic natural disaster, a terrorist event, being the victim of a violent crime, a community tragedy. Those are one-time events. Those are these single acute traumatic events, but they can produce long-lasting impacts. In the middle, harassment, embarrassment, abandonment, abusive relationships, rejection, codependence, many types of assaults and abuses, intimate partner violence, bullying, child abuse, grief, prolonged grief. A lot of those are going to fall within the chronic and the complex category. And again, at the end of this, to the far right, being the victim of an alcoholic or a substance abusing parent. So just experiencing that chronically in your life, particularly as a child, can be very impactful. Witnessing any kind of violence in your home, having chronic life-threatening medical conditions or medication-induced trauma, as well as being a caregiver for someone with chronic illness, or perhaps being a child in a home in which your family is chronically ill. Those are things that also can create long-lasting impacts. And then the bottom is a little bit more like of a systemic trauma. Now, we didn't put that in the category with acute, chronic, complex, and vicarious, but there is systemic trauma that can happen. Long-term exposure to poverty, lack of resources, racial and cultural violence, social exclusion and isolation, and hate crimes. So how does trauma affect our brain? We've got a graphic here, 3 main parts of the brain: the prefrontal cortex, the amygdala, and the hippocampus. So this is important because everyone experiences their trauma differently, and we have multiple ways that we are reacting to a trauma. And some of those ways are they kind of contradict each other. So we've got the parasympathetic nervous system. When it activates, we are in fight or flight. We have elevated heart rate, elevated blood pressure, rapid breathing, our adrenaline is racing. We also experience something called dorsal vagal shutdown. This is where the freeze response comes in, the disassociation response comes in. That can lead to slow heart rate, slow breathing, numbness, and disconnection. Now, those two look very different, and so it's important to understand that somebody experiencing trauma can experience both of those. How trauma affects the brain. So looking at these sections of the brain, this can also explain why trauma survivors may not experience trauma in the same way. And that can be confusing to somebody that doesn't understand. So for example, the hippocampus is responsible for memory and differentiating between past and present events, remembering and making sense of the trauma. With consistent exposure to trauma, that shrinks. We know that one of the things that can happen with trauma is that you may hyper remember pieces of your trauma. Pieces of that may become stuck and intrusive, and you're experiencing them and remembering them over and over. There are other people who experience complete shutdown. They cannot remember parts of their trauma. We know that when law enforcement is responding to somebody that has trauma, it's very typical that a person is not believed if they cannot remember key parts of their trauma, but that is a part of how trauma affects us. So some people can hyper remember, some people cannot remember at all. And for most trauma survivors, it's a blend of both of those. When we are experiencing trauma, the amygdala is incredibly active. The amygdala lights up. So when that is happening, more signs of post-traumatic stress disorder are present. We're kind of always seeking, we're always expecting danger. We are always looking over our shoulder. That's where that hyperarousal and hypervigilance comes in. And then the prefrontal cortex, that regulates emotions, that regulates rational thinking. So when we are experiencing trauma, this has a reduced volume, and it's very difficult to make decisions. It's very difficult to think rationally. And so sometimes when somebody has experienced trauma, it's very difficult for them to listen to other supportive people in their life who may be saying, it's okay, you're safe now, because their brain is not allowing them to believe that. One more slide about the brain. I think this is a really powerful visual that shows why people cannot just get over trauma. So a lot of people think that we should just be able to move past trauma, or that happened a long time ago, why does that still bother you? We know that trauma impacts brain structure. One of the sessions in our series a little later on is going to talk about ACEs, those adverse childhood experiences, and why those are so important. And this is a graphic to depict why that is so important. When somebody has trauma when they're younger and they're developing, portions of their brain can actually experience underdevelopment. If you have an underdeveloped brain, you're not going to be able to function at the level that you should be for your age. So this is why early intervention is very, very important, and why we need to remember that there are people who did experience trauma within developmental years, and it is very hard to just get over trauma. So what you can see here, the brain on the left is a healthy brain. The temporal lobes are intact, they're fully developed. The brain on the right is an abused brain. This is an image from an orphan that was institutionalized shortly after birth. And you can see that the temporal lobes are not fully formed. So this is going to impact emotional and behavioral regulation. So we know that trauma doesn't just affect the body, trauma doesn't just affect the brain, trauma affects everything. So the first slide here, looking at how it impacts our body. You can have a lot of these for a lot of different reasons, but if you've experienced trauma, it's important to know that some of this might be underlying some other chronic health issues. So pain, headaches, poor sleep, exhaustion, nightmares, hypervigilance, exaggerated startle, sweating, shaking, memory problems, dizziness, vision changes, elevated heart rate, elevated blood pressure, breathing difficulties, increased cortisol. Cortisol is a stress hormone, and increased cortisol in itself can lead to a lot of other medical conditions. So we want to try to keep cortisol low, do things to relax the body, so that we're not compounding those further issues, and suppressed immune system. So you can see this in both children and adults. Something that's important to think about is that children and adults tend to display trauma differently, primarily because children may not have the context, the words, the language to be able to express that something is happening to them, or understand that what's happening to them is affecting them. So while I might be able to say that I had an experience and it's causing me anxiety, or that I don't feel good because of it, a child may say, I have a stomach ache. I don't want to go to school today. I couldn't sleep. So if you are a person that's working with kids, you're going to notice this a lot in body and behavior. Moving on to behavior. How does trauma affect behavior? We can have flashbacks. We can have loss of safety, loss of danger cues. Sometimes it's difficult to figure out what's safe and what's not safe. So either everything can become dangerous, or maybe that person has no fear and they don't recognize danger. Each of those is equally risky. Scaring or startling easy, sudden episodes of fear, having obsessive or intrusive thoughts, nightmares, or dreams, that can be related to the trauma, that can be related to the future, and intrusively, obsessively worrying that the trauma is going to happen again. Trouble sleeping or concentrating, always tired. I think that's something that you can see a lot. If you are an educator, you know that if you have a student in your classroom and they are always tired, they're sleeping on their desk, there may be something going on at home. There may be something more going on that's causing them to have that behavior. Self-harming or self-destructive behavior, such as the misuse of alcohol, food, or drugs. Reenactment of the trauma and trauma mastery attempts. So a trauma mastery attempt is this kind of this idea and pattern of, if I either intentionally or unintentionally put myself in that situation again, maybe I can make it different this time. So maybe you're in a relationship and the relationship isn't healthy, and you have some kind of a violent incident. To stay in that relationship and to think, I'm going to make that argument better next time. I'm going to be able to change the outcome. The better I get at managing this, that can be a way of trauma mastery. Loss of trust in the world, others, and self. Avoidance behavior, avoiding reminders of the event, denying and distorting experiences. As a therapist, I meet a lot of people who will tell me that they had a good childhood, within the same breath tell me some of the worst things that I have ever heard, and then to cap that off say, but it wasn't that bad, or I know people that had worse. So minimizing and denying and distorting can be a way of surviving, and that can carry through to adulthood, where you just think it was normal and it was just a part of how you lived. And avoiding unpleasant emotions or circumstances. A little bit more about how it affects our behavior. Somatization, so we kind of talked about that child that may have anxiety and now they have a stomach ache. So chronic health issues, we convert a lot of stress into physical symptoms. Depression, anxiety, any kind of mental health condition. Sometimes when you're working with somebody and you dig deep enough, you find that there is a trauma that lies underneath whatever that mental health difficulty is. Mood changes, guilt and shame, temporary or long-term dissociation, over empathy or lack of empathy. This can be most often seen in somebody's boundaries. So if they have over empathy, they may have a really hard time saying no to people. They may have a really hard time not taking care of others, and perhaps get into situations that are, again, risky for them. or a lack of empathy, kind of turning themselves off and kind of numbing themselves to the world around them and to the people around them that love them and want to care for them. And problems in relationships and problems with intimacy. So now that we kind of know how it affects body and behavior, let's look at the 4 trauma responses. A lot of people know about fight, flight, or freeze. There is also fawn, and I will get into what that is. So these are the 4 main trauma responses. Fighting is a reactive and a defensive response. So if I'm fighting, I may be more aggressive. I may have mood swings. I may appear to the world that I have a chip on my shoulder. I am always ready. I'm always hypervigilant, and I'm ready to go. And that's how I've taken care of myself. Flight, if I'm running away, I'm avoidant, I'm withdrawn. This is how I'm choosing to keep myself safe, is I'm going to avoid anything that I think is going to re-traumatize me, anything that looks or sounds or smells like the trauma I've endured, I'm going to avoid it. And that is fleeing. Being avoidant, being withdrawn. So fleeing isn't always physically running away. It can also be I'm withdrawing and I'm shutting myself away from people that are trying to help me, and maybe isolating myself. That kind of goes into freezing. So being unable to make decisions, being avoidant, numbing with substances, just kind of general ways to not think about and not feel and not remember or re-experience whatever it is that has happened to me that has caused this traumatic response. And then fawning. Fawning is people pleasing. Fawning is having a lack of boundaries, being codependent, having low self-esteem. So a fawning response can look like maybe somebody in your classroom, if you're an educator, nods a lot when you talk to them, and you ask them if they have any questions and they say no, and they agree with everything that you say. And then the next day, perhaps they bring in an assignment and you realize they really didn't understand. They didn't ask for help. And maybe they kind of told you what you wanted to hear, because fawning is people pleasing. It's doing what they need to do in the moment to avoid perceived harm. If I keep the person in front of me happy, they're not going to hurt me. We can also see this in abusive relationships. If I agree with, if I do whatever this person needs me to do, even if they've hurt me, even if whatever I'm doing is actually hurting myself, if I keep the other person happy, then I will be safe. So that's a fawning response. So now that we've talked about trauma, what is trauma, how it affects the brain, we're going to talk a little bit about what is trauma-informed care. Trauma-informed care is an approach that focuses on an understanding of and responsiveness to the impact of trauma. It promotes positive outcomes by emphasizing physical, psychological, and emotional safety, and enhances well-being by empowering individuals to define their needs and goals and make choices about their care and services. So trauma-informed care encompasses a lot of things, and it starts the moment that you're having an interaction with someone. So trauma-informed care includes how you're interacting with someone in front of you. It includes what your environment around you looks like. Are you providing a safe environment for someone? And can they make choices about themselves and about their care or about what's going on around them? One of the sort of hallmark experiences that trauma survivors have can be a sense of powerlessness and helplessness. So keeping that in mind when interacting with somebody with trauma is important, because you do not want to accidentally or unintentionally do or say or set an environment around them that somehow makes them feel powerless or like they don't have a voice. So a guiding perspective is what happened to you, not what is wrong with you. So again, trauma is something that somebody has experienced. It was not their fault, but a lot of trauma can make people feel like they have done something wrong. They may be asking, what is wrong with me? Why am I experiencing this? And trauma is something that, when experienced as a human with a brain and a body, we are just trying to survive the best that we can and make decisions that we can in the moment, that best serve us. And sometimes those decisions don't work out for us later, or it wasn't the safest or the best decision, but that person is doing what they can with what they have to take care of themselves the best they can. So what happened to you, not what is wrong with you. There are 6 principles of trauma-informed care, and this series is kind of going to expand on those and is modeled after these. So these 6 principles are something that you want to keep in mind when interacting with someone who has experienced trauma. Safety, trustworthiness, and transparency, providing peer support, collaboration and mutuality, empowerment, voice, and choice, and cultural and historical and gender issues. There are 4 R's of trauma-informed care. Realize, recognize, respond, and resist re-traumatization. So I think a lot of people attend trainings like this and go, okay, I know what trauma is. I think I can spot it, but what do I do now? How do I support somebody who may have experienced trauma? So the first thing you want to do is realize that they've experienced trauma. Realize what is trauma and how it may be affecting an individual or a group of people. Recognizing the signs and the symptoms of trauma, both behaviorally and emotionally. So seeing it happen in front of you, knowing that somebody perhaps went through something, and then being able to notice their behavior patterns, their emotional patterns after, to be mindful that they may be having a trauma reaction to whatever happened. Responding. Have a system in place that can respond to trauma in a way that lets individuals feel that they are heard, seen, and safe, and that their choices and needs matter. And resist re-traumatization. This is probably one of the most important ones on here, because we know that even if we have the best of intentions and we're very good at helping, if we don't go about helping in the right manner, we could accidentally re-traumatize someone. So rejecting labels, challenging shame and blame, providing choice, react with empathy, be culturally aware, and don't expect survivors to continuously retell their stories. One of the programs, and I am not entirely sure which school district is doing this, I've just heard about it kind of through some of these meetings that we've been in, that I really like is this program that someone has mentioned, Handle with Care. That's happening within schools. And my understanding is the premise there is that when something has happened to a child in their home, that someone is able to notify the school and that student is then handled with care, but not everyone knows exactly what happened. So they're not having to say what happened. No one needs to know exactly what it is that child went through. They just need to know something is happening and this child may need extra support. And that's a really great way to avoid re-traumatization.
I hate to say, but we have 1 minute left.
Oh my goodness. Why is this important? The truth about trauma. Anyone can experience. Trauma is not a sign of weakness. Trauma manifests differently for different people. Trauma symptoms don't go away on their own, but they are treatable. I'm going to kind of speed because I want to get to this slide. If you take anything away from this presentation, I want you to take this away. Empathy and awareness help defeat stigma. So this is something called trauma glasses off, trauma glasses on. So if you look at somebody who has experienced something, and keeping in mind that somebody who's experienced trauma is not always going to react or behave in the way you think they will, or the way that you think they should. Knowing that they've experienced something can help you interact with them in a more neutral and a more empathetic way. So you could say that somebody is manipulative, or you could put your trauma glasses on and say, that person is getting their needs met in a way that's worked for them in the past. They are doing whatever is necessary to survive. You can read down the list here. Lazy. Is that person lazy, or are they overwhelmed Do they even have the skills to make the decisions about what they need to do first or to organize? Do they even have the support to be able to make those decisions and to have those skills? So this is just a handful of words. You can kind of do this with anything. Something to ask yourself is, what is the best reason? What is the most kind and loving and best reason I can think of why this person in front of me might be making that choice that I think maybe isn't very healthy for them? And can I see how that choice may have helped them in the past, even though it's not helping them now? And I think I am out of time, so I will leave you with this last slide, which is, these are our upcoming sessions. I had to breeze through all of that very quickly, so these next sessions are going to be able to get into some of that a little bit more, and really focus on those trauma-informed principles that we covered. So I hope you can join us for those.
Thank you. And I just put some instructions. If anyone has a question, you can raise your hand, you can ask, you can put it in the chat, and I'll monitor the chat. And Jeff would like the trauma glasses graphic in a shareable format.
Absolutely. Yes, I can send that graphic in an email to anybody that would like it. I can send it to everyone who attended, whatever anybody would like me to do. All right, I'm not seeing any other questions. Okay, I will send to all.
And what were the instructions for the evaluation?
So when everybody, when the video or the meeting stops, the survey should pop up on your screen. It's a very quick 2-minute survey. If everyone could complete that, that would be appreciated.
Okay.
So Sylvia, is there anything else you want to say before we end?
Thank you all for coming, and I hope you can join us in 2 weeks for the next session.
Thank you, everyone.
Thanks, Tamara.